This is a presentation on, so your patient is having surgery. Let's prepare your patient for their procedure. You are the first line of defense in making sure your patient is safe during surgery. My name is Catherine Holloway and I am presenting this presentation as part of my Senior Practicum for ECPI's RN to BSN program. At the end of this presentation, I will ask you to take a quick quiz to evaluate knowledge content. Thank you for watching this presentation, and please use this information to help you get your patient ready for surgery. At the end of this presentation, the nurse should be able to understand what is involved in NPO status, the importance of having a functioning IV access for surgery, and what parameters and vital signs are needed for a patient to go to surgery. This presentation should help bring a better understanding of what medications can be given before surgery, as well as which ones to hold, to understand the importance of fingerstick blood sugars and how to treat a patient going to surgery, to understand all the sections of consent to complete, as well as why a patient should be oriented to sign their consent, to check the lab results for abnormal values and report them to the physician, to demonstrate how to use the preoperative flow sheet as a communication tool, to understand what to include in a handoff to a preoperative nurse or OR nurse, and to learn about contact information and hours of preoperative department. Surgical patients should be NPO after midnight except for a small amount of water with their medications. NPO, of course, means nothing by mouth. No food, no applesauce, no juices, no soda, no ice chips, no cups of water, no chewing gum, no mints, no hard candy, basically nothing in the mouth, and tube feeding should be stopped at midnight. Do not give a medication if the patient cannot swallow it with just a small amount of water. Especially do not crush it and put it in applesauce or pudding to give to the patient on the day of surgery. Instead, ask for the IV version if it is necessary medication such as for blood pressure or seizures. If your patient has comorbidities of obesity, diabetes, gastric reflux, GI issues, then they have an increased risk for aspiration. The Riverside Regional Medical Center Policy Number 5365 states that the intention for fasting guidelines is to prevent aspiration of gastric contents into the lungs during anesthesia and sedation. The recommendations for fasting come from the practice guidelines for preoperative fasting. If anything is given by mouth, by NG tube, or by PEG tube, then the patient's surgery can either be canceled or delayed by 8 hours. This delay will cause an increase in the length of stay for the patient. It can also possibly cause a delay and length of stay increase for other patients as well when this patient is delayed. Medications which should be given the morning of surgery include beta blockers. Most of these medications end in LOL and are given to protect the patient's cardiac status during surgery. Examples of beta blockers are metoprolol, atenolol, carvedilol, and propranolol. Antibiotics should be administered as scheduled and not held. However, antibiotics on call to the OR will be administered in the OR. It is advisable to administer the Tylenol, gabapentin, Neurontin, Celebrex if they are already ordered because they help decrease the quantity of narcotic pain medication needed after surgery. If the patient is complaining of pain or anxiety, please administer their pain medication and anxiety medications as well. It is more difficult for the pre-op nurse to acquire the approval to give these medications than it is for the floor nurse to administer them before they come to pre-op. Seizure medications, medications for gastric reflux, thyroid medications should all be administered the morning of surgery with just enough water to get them down. No other liquid except water should be used for these pills. Potassium and electrolyte replacement dosages should be administered once acquired from the pharmacy. If the patient has orders for potassium runs, please start them and send the remainder of the runs with the patient to the pre-op operating room area. Also, any magnesium, calcium, or any other electrolyte replacements should be given as ordered and as soon as acquired. Please give any medication ordered by IV route as they do not need to be held unless there are parameters to do so. Give all respiratory inhalers and respiratory treatments to patients who require these and are ordered for them to be done. Medications that should be held the morning of surgery include any long-acting insulin and oral diabetic medications. These are held to avoid a drop in the patient's blood sugar during surgery. It is safer to be a little elevated than to have a drop in the blood sugar level. All blood thinners, unless otherwise specified by the physician, should not be given. If the patient is on heparin drip, please check with the physician to see when they want it turned off. Ideally, when we have patients come in from home, they stop these blood thinners 5 to 7 days in advance, but the patients come in from home through the emergency room, so it is important for us to know when they took their home dose last. Diuretic medications such as Lasix or medications with HCTZ should be held in the morning of surgery. Medications that end in PRIL or PRIL, also known as ACE inhibitors, should be held to prevent an increase in drop of heart rate and blood pressure during the operating room, which requires an increased use of vasopressor to maintain the vital signs. Any medications that must be crushed and mixed in greater than 30 milliliters of water or an applesauce or pudding should be held. Ask for IV alternatives if needed for blood pressure, seizures, etc. Riverside Regional Medical Center's policy number 2329. Nutritional insulin will be held when the patient does not eat meals. Basal insulin should never be held while a patient is NPO waiting a procedure. The healthcare provider may order adjustments to the insulin dose based on the length of procedures, such as in type 1 diabetes patients. As far as your patient's IV site goes, it's very important that you ensure the patient's IV site, PICC line, and central line is functioning before the patient comes to the pre-op area. We understand our patients do not come to the hospital with the best vasculature due to dehydration or other medical issues, but it is important to please ensure that the patient's IV site is functioning by flushing it and attempting blood return before the patient comes to the pre-op department. Check the site for any infiltration and remove any non-functioning IV sites from the patient and also from the patient's medical record. If there is a bag of IV fluid infusing, make sure the clamp is open and that it is dripping. If the IV site is not working, please attempt to restart a new IV site before the patient leaves your unit and comes to pre-op. According to the Riverside Regional Medical Center policy number 4147, the nurse should evaluate the IV for patency and restart it if it is not functioning. If the patient's IV site is not functioning, please try to restart it before the patient comes to pre-op. If the patient is known to be a difficult IV access and this is an ongoing issue, please bring it to the attention of the attending physician and request for potential placement of a PICC line or midline as appropriate, preferably before the day of surgery. This should not be something that waits until the morning of surgery if it is a known problem. PICC lines and midlines cannot be placed in the pre-op department. When the patient does not have a functioning IV access, it causes a delay in the start of the surgery, and if they require either PICC line or midline, then the surgery may even be postponed or canceled until one can be acquired. If it occurs the morning of the surgery and you're unable to acquire a new IV access, please notify the pre-op department at 534-6034 or 534-6036. Or if it is done before 0500, notify the OR at 534-6030. The anesthesiologist's charge may be notified if you cannot reach pre-op or the OR staff, and their number is 634-5300. A nurse may attempt an IV access for up to 2 times, followed by an attempt by another nurse 2 times, and then it must be reported to a physician for further evaluation and IV access. The head of our anesthesiology department has requested that I point out this job aid that's listed in our policies number 6784. It says an escalation process for IV insertion should start first with the RN on the nursing unit, should attempt no more than twice, and must document the attempts to include the location and IV gauges that were attempted. Second step is to use the unit charge nurse or nurse manager to attempt the site. Should attempt no more than twice and must document those attempts to include location and IV gauge as well. Then a PICC consult order for IV by ultrasound should be placed if it is between the hours of 7:30 in the morning and 6 p.m. If not, then page the nursing supervisor if it is between 2 o'clock and 7 o'clock in the morning. The critical care charge nurse or emergency room charge nurse may be called for assistance in starting IVs when needed. Anesthesia may also be called as a very last resort for dire emergencies, but availability of anesthesia is dependent, of course, on the OR caseload. The IV fluid that is used in the operating room is LR. If the IV fluid you have hanging is D5 or KCl in it, please discontinue that and hang LR in place of it. Please continue any electrolyte replacements that are ordered or any dextrose replacement that is being used to treat low blood sugar for the patient. For a patient who is on dialysis, the IV fluid we use for these patients during surgery is a 500 milliliter bag of 0.9% normal saline on mini drip tubing. This is to help eliminate the dialysis patient from receiving too much fluid. In report, please make the pre-op nurse aware when the patient had dialysis last. Ideally, the patient should have had dialysis the day before surgery. If they do not and go the same day, then the patient must wait 6 hours before they can go to surgery. A potassium level is always checked on every dialysis patient to ensure they are safe to go to surgery. Please report the amount of fluid received during dialysis, if the patient received any blood products or medications during dialysis treatment, if the patient urinates still or is anuric, and where the dialysis catheter access is located, and if it is functioning to the best of your knowledge with a positive thrill and bruit. Riverside Regional Medical Center's policy number 7130 states that an outpatient going to surgery should have received dialysis the day before surgery. A potassium level should be checked the day of surgery. An inpatient on dialysis should have received dialysis the day before surgery preferably. However, if dialysis occurs on the same day surgery can be completed 6 hours after the dialysis is completed. In case of emergency, the surgery can be performed irrespective of when the dialysis was performed. For the patients who are diabetic, please monitor them closely, especially if their surgery will not occur until afternoon. Please check their fingerstick blood sugar as directed, but also recheck the fingerstick blood sugar once the pre-op nurse takes or is given a report. There must be a fingerstick blood sugar reading within 1 hour of the patient going into surgery. Treat any abnormal results according to protocol. Please notify the physician if the fingerstick blood sugar is greater than 180 or less than 80, and also notify pre-op at 534-6034. Do not treat a low blood sugar by giving the patient something to drink unless it has been okayed by anesthesia. There are occasions where the patient is allowed to have up to 4 ounces of apple juice as long as it is at least 2 hours before they will be going to surgery. But please verify this with pre-op or anesthesia charge before this is given to them. Riverside Regional Medical Center's policy number 2329 is called the Diabetes General Guidelines Policy. Check your patient's orientation status. Ask them, what is your name? What is your date of birth? What month is it? What year is it? What procedure are you having done? Is the patient confused? Is there a diagnosis of dementia or Alzheimer's? The patient must be fully oriented to be able to sign their own consent form. If the patient cannot answer these questions, or appears and sounds confused, or has a diagnosis of dementia or Alzheimer's, then there will need to be an alternative individual who can sign for them or a designated power of attorney if they are available. If the patient is unable to answer these questions accurately and there is any question of orientation, they cannot sign their own consent. Please acquire a name and phone number of a person designated to sign forms for them. This can be done when the family member is in person at the time of admission or when it is determined the patient will need to go to surgery. It is important if they are not going to be able to be at the patient's side to please ask them to be available to be contacted for consent from the physician and the anesthesiologist. If there is power of attorney paperwork in the chart, please inform the pre-op nurse during report. Riverside Regional Medical Center's policy number 2149 states informed consent is defined as the expressed consent by a patient displaying understanding of the benefits, risks, and alternatives of a proposed procedure, and with an exhibited understanding of how this proposed treatment is likely to affect the individual. If the patient is incapable of making an informed consent due to mental illness, intellectual disability, or any mental or physical condition that impairs the communication and judgment and is unable to understand the nature, extent, or probable consequences of the proposed healthcare decision, then consent should be obtained from the patient's legally authorized representative. When the floor staff assist in completing the consent form on the nursing unit, it is important to make sure that all the lines are completed. The signature, date, and time of the patient and relationship of the person signing it must be completed. It is also important that whomever witnesses the signature sign the consent form and complete the date and time as well. It is okay if the physician has not signed it yet. Ideal if they do, but their date and time also needs to be completed if it is done on the unit. If the consent is acquired by phone on the nursing unit, then the witness must be in presence of the physician during the conversation, and 2 nurses must witness the consent. On the consent, write phone consent acquired or received from whomever is a designated person or power of attorney, their relationship, the time and date called, as well as writing the phone number on the consent. Ensure that both nurses have signed it as well as the MD who did the phone consent along with the date and time. Riverside Regional Medical Center's policy number 5364 states that a pre-anesthetic evaluation will be completed within 48 hours of surgery and an informed consent from anesthesia will be obtained prior to delivery of anesthesia. A reevaluation is done immediately prior to the initiation of the anesthesia plan. Please acquire a recent set of vital signs for the surgical patient. These vital signs should be taken within 1 hour of the patient coming down for their procedure, and they should be recorded in the medical record. Notify the physician and treat any abnormal vital signs as detected. Notify the physician of a systolic blood pressure greater than 180 or less than 90, a heart rate greater than 110 or less than 60, a respiratory rate greater than 20, also a respiratory rate that is labored or short of breath, any temperature greater than 99.5, and of course if the patient is symptomatic. If the previous set of vital signs were abnormal, please recheck a new set prior to bringing the patient to the pre-op department. It is important that before the patient goes to surgery, they must have blood work completed. Make sure that any labs ordered have been collected and in process the morning of the patient's surgery. Once the results are in the system, please check to see if any of the results are not within normal limits and how they compare to yesterday's values. If the values are significantly different or are low and have not been treated by the physician, please notify the primary physician and surgeon. A low hemoglobin is less than 10 and a low hematocrit is less than 30. A low platelet count that will require a transfusion is 100 or less. An elevated INR level of 1.5 may require fresh frozen plasma. A low potassium less than 3.5 may require replacements via oral or IV, and a high potassium greater than 5 will require further evaluation by the physician as well. Low magnesium and calcium may require replacements via IV. An elevated creatinine needs to be reported if there is a change during handoff, as many medications are metabolized through the kidneys. And low glucose levels should be treated with IV medications and not soda or juice when the patient is going to surgery. A high glucose level should be reported to the physician with possible administration of short-acting insulin. Riverside Regional Medical Center's policy number 3145 states that the inpatient nurse receiving critical results verifies the critical finding, evaluates the patient, calls or pages a physician within 15 minutes of receiving the critical value to receive instructions on patient care actions indicated. If the physician does not call back within 15 minutes, the nurse pages them a second time, and so forth up the chain of command according to the policy. Some of the patients require a type-in screen be completed prior to going to surgery. If a type-in screen has been ordered, then please ensure that the patient's blood has been collected and that they have on a blood band that is within 72-hour time frame from collection of original specimen. If the physician has ordered a blood transfusion, please start the blood as soon as it becomes available. Please hand off if this is present and if they are aware of any blood units that are available. If the patient is refusing blood products, please make the pre-op nurse aware and ensure that the blood refusal form has been completed or if the patient is a Jehovah's Witness. According to the Riverside Regional Medical Center Policy Number 6173, blood must not be administered to a patient if the red armband has been removed. The sample collected can be used for cross-match for up to 3 days, then the armband should be kept on for this period of time. If it has been more than 72 hours, please remove this old blood band, order and recollect the specimen. According to the Riverside Regional Medical Center Policy Number 6173, a type and screen takes about 1 hour. A cross-match can be ordered and ready within 15 and up to 90 minutes once a type and screen is performed. Additional time may be required if antibodies are detected in the patient's plasma. When lab work has not been completed and abnormal results have not been addressed prior to the patient coming to the pre-op department, then it can delay the patient's surgery, possibly cancel the procedure, and increase the length of stay of the patient. If abnormal labs are not recognized and treated, then it could endanger the patient during the surgery and result in poor outcomes for the patient. Sometimes the patients like to wear their belongings down to the pre-op unit. However, all personal belongings such as clothing, cell phones, jewelry, any other electronic devices must remain in the patient's room when they come down to have surgery. The patient should be in only the hospital-provided gown, hospital-provided socks, and personal undergarments should be off. Remove telemetry boxes and keep them on the nursing units. Incontinent briefs and disposable mesh underpants can remain on the patient. The pre-op department, OR, and PACU cannot be responsible for these items and must be returned to the nursing unit. It will require a staff member coming to pre-op to pick them up if any of these items are brought into the pre-op department. Riverside Regional Medical Center Policy Number 3292 states that the patient is asked to remove all clothing, including underclothing and hospital gown, is provided. Disposable undergarments can be provided as long as they do not interfere with the procedure. If the patient is coming down for surgery today, encourage them to bathe themselves in the morning and provide the needed towels, washcloths, soaps, supplies that they will need to use to accomplish this task. If the patient cannot bathe themselves, please give them a bath the morning of surgery and change to clean linens. Reassess the patient who is incontinent frequently and send the patient to pre-op in clean incontinent briefs. If CHG wipes are available in the nursing unit, please wipe down the part of the body that is having surgery after bathing. These wipes can be obtained from the pre-op department or can be added to the PAR. The only areas we do not use CHG wipes on are underarms, groin, personal areas, facial locations. Cleansing the patient helps to prevent infections. Send a clean patient to the OR. Riverside Regional Medical Center Policy Number 3319 states that the perioperative RN will assess the skin at the surgical site and prepare the skin for antisepsis. The skin should be washed with facility-approved soap preoperatively, removing soil, debris, emollients, cosmetics, and alcohol-based products that are present at the surgical site. Cleanse area of greater contamination that are near the surgical site before antisepsis, such as umbilicus, skin folds, foreskins, under nails, around stomas and catheters, around drainage devices, around colostomy and anus area. Perform hand hygiene prior to using any CHG wipes on the surgical area. The pre-op flow sheet should be completed by the nurse on the unit, preferably by the night shift nurse after midnight before 6 o'clock, so that it is not forgotten. Often a good time to do this is when the assessment is done before the change of shift. This can also be done by the day shift nurse if they have a new patient who has been admitted and needs to go to surgery. This flow sheet can be wrenched into the flow sheet section in Epic. When wrenching it in, type the word pre-op, the word PRE space OP. The flow sheet functions as a communication tool for NPO status, making sure the patient has voided prior to surgery, does not have any personal belongings on them, and that their IV is functioning well. According to the Riverside Regional Medical Policy Number 616, patients undergoing surgical and/or non-invasive procedures should have an assessment completed prior to the procedure. The preoperative checklist is used to assess the patient's preparation and condition during the preoperative stage, which includes a verification consent form, a confirmation of operative site by the patient and or family and healthcare providers. Any issues noted on the preoperative flow sheet and during this nursing assessment should be brought to the attention of the physician and surgeon, anesthesiologist if appropriate, and during handoff to the preoperative nurse. This is the last section of the pre-op flow sheet and should be completed for date and time of last liquid, date and time of last solid, and date and time of last medication and beta blocker administration. When a patient is having surgery, it is important to call report to the nurse in the pre-op department and or the OR for proper handoff before the patient arrives in the preoperative unit. There are two ways a report can be given. Report may be given when the pre-op nurse calls to acquire the report, or you can call the pre-op department at 534-6034 and give report to the inpatient nurse or to the charge nurse. This second route would be important if you are going off the floor or going to lunch. If the nurse is not available when you call in the pre-op, she will call you back. If you must leave the floor before giving a report, then hand off to your charge nurse so that they can give our inpatient nurse a proper report. We are both very busy and must be patient with each other during this process. It is important information to hand off according to the Riverside Regional Medical Center's policy number 4147, which should include when the patient ate and drank last, their allergies, pertinent history, IV site, other drains or tubes present, vital signs, any issues overnight related to surgery, medications administered to include pain medication, anxiety medications, antibiotics, anticoagulants, and beta blockers, or blood pressure medications, plus any IV drips that are infusing. Basic assessment information such as respiratory status, need for oxygen or breathing treatments, and orientation are very important for handoff as well. It is also important to let us know if the patient should be on a telemetry monitor so we can attach them to the cardiac monitor in pre-op. If the patient is having an extremity being operated on, then the pulses and circulation status are important to check. Also report any dressings present as well as any other concerns regarding the patient pre-op should be aware of. The most important thing that we want you all to know is that we are willing to help you, so let's do this together. If you have any questions, please call us. The pre-op department 534-6034, the OR at 534-6030, or our anesthesia charge at 634-5300. Pre-op is open Monday through Friday from 5 o'clock in the morning till 7:30 at night and closes from 7:30 at night till 5 o'clock in the morning. But the OR is available to answer questions regarding issues when the pre-op department is closed. If you are not able to reach the pre-op or the OR or do not feel your question has been answered, then please call anesthesia charge at 634-5300. Thank you for all your cooperation in preparing our patients for their transition to surgery.